Thank you for joining us today for our Connect class. We are here today to talk about Meraki and the healthcare vertical. Per usual, as your host, my name is Shara Johnson, and I am the Meraki BD here at ScanSource. Just a few things to cover before we dig in. So at ScanSource, there's some things that we offer to help you better understand Cisco and Meraki. We focus on two architectures, collaboration and networking. Under collaboration is our branch called Evolve, where we have trainings on WebEx Teams, WebEx Meetings, WebEx Calling, and a couple of the endpoints. Under networking, we actually have 3 classes. We have the Meraki Connect, which is what you're joining today, where we like to change the topic every month, hopefully around something that's relevant to what's going on in the networking world. And then we have our 2 Meraki classes. We have the M101, which is a 2-hour sales-oriented training that covers the entire Meraki portfolio with some demo in the dashboard. And then we have the M201, which is a 4-hour technical training. It covers the same information as the 101, but it gives you those 2 extra hours to get that firsthand experience with the dashboard via labs. That's it for me. I'm going to pass the ball to our other host, Lauren Ziebig from Meraki, who is going to discuss Meraki and the healthcare vertical.
Thank you, Shara. I'm going to pop up on my screen some slides for today. Everybody should see it, I think. Yeah.
Yep.
So my name is Lauren Ziebig. I am the manager of the Cisco Meraki distribution team covering the Americas. So my team leads both the US, Latin America, and Canada. But today we're here to talk about Cisco Meraki really helping our kind of the front line when it comes to healthcare. I want to kind of cover what we're going to talk about today. And try and set a baseline. So as you all know, we're kind of living and working in such a different environment than we did previously. And like y'all, our healthcare workers are also navigating kind of this unexpected change in daily life. So today I really want to discuss kind of what Meraki is doing to support our customers and support you as our partners as it relates to healthcare, but also want to say thank you and really express my gratitude for the partnership that you've had with Meraki and also the partnership that you've had with ScanSource as well. So today we're going to talk about, the state of healthcare IT, where we are today, and really establish that baseline of the environment that we're all living in and what our communities are facing when it comes to healthcare. Then we're going to step into the Meraki solution. So we'll take a look at what Meraki is doing within the community to solve these tough problems. And then we'll wrap up with some of the partner tools as it relates to offers, some best practices, where you can find some resources, as well as some financing options that Cisco has provided to kind of help support you through this time. So again, we're going to talk about healthcare as a specific vertical today, but this still holds true with our mission at Meraki. So we believe at Meraki that by simplifying powerful technology, we can really free passionate people to focus on their mission. And that rings even more true today because we know our healthcare workers, want to keep themselves safe, but also their patients as well as they navigate through this. And we know that it's just not, our healthcare workers and essential workers on the front lines. You as an IT staff are also working very closely with, our healthcare providers in order to keep them connected during these critical times. So, thank you again for your support there as well. Now we're going to jump into kind of the state of healthcare and IT currently. So today, we are here to get a little bit more detail and understanding of what that current state looks like, how to address those issues. We want to share some solutions for the now, but also kind of creating a roadmap for stability in the long term as well, and including foresight into future issues and how to prevent them. So first, we're going to take a look at 4 of these different types of challenges, or what we're really seeing in the healthcare industry today. So logistical challenges. This has been a very sudden, widespread challenge that has caused some logistical issues. So including, inventory being one of those issues. We see a lot of our healthcare providers trying to get equipment and doing that fast. And that can create more of, we need it now without limited research, which kind of goes into the reactive research. Healthcare providers have little time to really do any type of in-depth research. And that's where they can really lean on you, the partner, to be that consultant and to really guide them through kind of their purchasing decision that they're making. And then when we look at kind of tech deployed in novel ways, one thing that comes to mind for Meraki is our physical security line, the MV. We actually have a customer that's utilizing our physical security line to monitor patients. So it prevents our doctors and our nurses from spending too much time in the room and putting themselves at further risk. So we're seeing a lot of our customers do that. And then just limited critical IT staff. What we're all familiar with Meraki is simplicity and the ease of use. And it was really built for that lean IT environment, and that lean IT staff were able to kind of get things up and running quickly and troubleshoot remotely as well. So I'm going to kind of pause there, and I'm going to really take you kind of on a journey of where Meraki started and kind of where we are today. So back in 2006, a couple of MIT grad students were working on a project called Project RoofNet, where they were basically blanketing the city of Cambridge with free Wi-Fi. So they were providing access points all along the rooftops. After that project, and they did that through a cloud-based dashboard, and after that project, they came out to California to present their findings. And someone came up to them after their presentation and said, "I love your product. I want 10,000 units," or something like that. And they were like, "Well, man, like there's no way that we can provide that for you. We don't have a company. We don't have any type of manufacturing. We're just some grad students that were trying to get an A on a thesis." So that person became Meraki's first investor from Google Ventures, and Meraki was born. Since then, Meraki launched their firewall or MX appliance. So that's our security and SD-WAN product. And then their switches, the MS product. And then around that time, Meraki was acquired by Cisco in December of 2012. And we are one of Cisco's fastest growing portfolios. And since then, we've had several different product categories, including Meraki Insight, which we'll talk about as part of the solution for our healthcare providers. But Meraki Insight provides application performance monitoring that's basically stacked on the MX, it's a license. And then we have Systems Manager, which manages those endpoints. So your kind of laptops, your iPhones, your iPads, managing how those are being used. And we all know that, now in a healthcare environment that they're constantly kind of using those type of endpoints, and we want to make sure that they're safe and they have the right applications on them. And then more recently, our physical security line. So the MV is the fastest ever growing product that Meraki has brought to market. And we've done quite a few kind of launches this year, and we're definitely going to see that product grow going into FY21, which that's Cisco's fiscal year, which starts at the very end of July, early August. And then several months ago, we launched the MG, which is a cellular gateway for Meraki. But what you'll notice kind of above all of this on the left-hand side is the dashboard, that image of the dashboard. So that's really the secret sauce of Meraki. That's Meraki's flagship product. That's where everything is configured, remotely monitored. You can do troubleshooting from anywhere. I mean, I'm here in a home office, and just like an IT professional, they can be doing that kind of on the go for their healthcare customers as well. And then on the right-hand side, you're going to see, the different integrated solutions that Meraki can provide, or our technology partners can provide based off of our open API. So we're doing more than 50 million API calls a day. We opened up our API in, I want to say it's almost been 2 years, and we've really grown a marketplace and a group of ecosystem partners that really provide features on top of what the Meraki dashboard can provide, because at Meraki we want to keep it simple. That is our true value to the market. If we could put simplicity on a spec sheet, we would. But in order to keep our products, simple and our features simple, we kind of really go after 80% of our use cases, and then we provide that open API so other partners can create applications that are focused on specific use cases that end customers like healthcare providers need to leverage. So speaking of that, you can go to create.meraki.io to build your own API. There's instructions on how to do that, or build your own applications. You can also kind of search the marketplace of applications that have already been created and ecosystem partners that you can partner and leverage in order to help those customers. And just recently, this week, we launched several new business outcome solutions that are primarily focused on COVID-19 or can be utilized. So that includes contactless engagement, contact tracing, safe occupancy, safe navigation. So I encourage you to check that out. Go to create.meraki.io and you'll scroll down, select business outcome solutions, and you'll see this section that you'll be able to click on for further information. Now we're going to kind of head back over to the Meraki solutions for healthcare as well. And first, that being our hospitals. So let me go back. So the three main areas are going to be hospitals and clinics. So we're seeing new approaches to pop-up facilities. We're also seeing long-term healthcare take a pretty big impact to this change since they're not very well equipped to more people on their network. And you will see this theme kind of throughout the healthcare facilities that the IT networker really needs something that we like to call kind of the 4 S's, which is speed, scale, simplicity, and security, and really help for today, but also for the future as well. And as we all know, that Meraki is very focused around simplicity and being able to scale quickly, which is why it's so easy to kind of spin up a network in minutes or kind of on the go. So let's transition to hospitals. So traditionally, we do not see hospitals kind of in the same way as that we're seeing right now. So if we look at kind of what has changed, we're seeing hospitals or field hospitals pop up as inside of convention centers, inside of parking lots, and we've even seen churches, stadiums, people's homes. And these aren't necessarily directly owned or managed by a hospital. So these facilities were not created for that type of function or managed by kind of that hospital. So how can Meraki really help these type of customers? We can help with the deployment. We can configure in transit. You don't necessarily have to get to the location to start making those changes and creating those configurations. We're able to really get up a network in minutes and deliver kind of that secure access back to the headquarters. We're also able to kind of leverage the MV as well. So if we look at the Meraki kind of solutions example, you're going to see us leveraging security and SD-WAN, which is kind of our MX product line. This really helps all facilities to connect back to their main campus, along with kind of leveraging MI, which is that Meraki Insight that provides kind of analytics around how the applications are performing and really the overall health of the network. And you'll also see us leverage our wireless solutions, both indoor and outdoor access points, which is our MRs. And then again, leveraging the MV for customers using cameras to really minimize the time that they're exposed to some of those patients as well. So now we're going to move on to clinics. So this is where we're seeing a kind of new approach being taken to kind of reach their patients. We're seeing a lot of preventative and outpatient care, blood donation pop-ups, and testing facilities created, and move really towards telemedicine to reduce that exposure and create those pop-up clinics for testing that aren't necessarily inside a normal clinic. And this is where we really need to move to a more reliable and telemedicine solution, and think about kind of working from home inside the telemedicine field, but also be able to securely access, again, kind of that main campus and monitor those applications and troubleshoot the network remotely. And due to our open APIs, we're really seeing these type of clinics kind of measure traffic and activity. So that could be by day, per hour. That could be, how many people are entering, how many people are leaving. So we're able to kind of provide those types of analytics on top of the Meraki dashboard. And this is actually an example below of a real actual customer that we had that was able to achieve a telemedicine and teleworker model. So they were utilizing 2 of the MX450s at the head end. They were also utilizing 300 of the MX68Ws, which is built-in wireless, and then 10 of the Meraki Insight licenses to monitor their application performance. So finally, we're going to touch on long-term healthcare. So kind of what has changed there. Really, it's the ability for those residents to connect with their families and friends. I'm sure every one of you on this call has someone, either you have a loved one that's inside of a long-term healthcare facility or know someone that does. And we want to create a reliable network that gives them the ability to kind of connect with those family and friends via video, including some of the Cisco Collab tools as well, to really maintain that quality of life and that connection to the outside world as well. And what is Meraki doing to kind of help that? It's lean IT. A lot of the long-term healthcare facilities have a very small IT staff. If anything, they are not prepared for this type of network or this type of bandwidth, and they really want to reduce the time that's spent inside of these facilities, because these are the most at-risk type of patients. So by limiting the use of them having to come in and troubleshoot, being able to do cable tests and analysis and really remotely monitoring, this prevents them from excess time inside of these facilities. So if you look at kind of what does that Meraki solution look like, that would include, our wireless product and MR, a switch, a security and SD-WAN product, even some smart cameras to make sure that the staff is following proper protocol and they're, limiting their exposure there as well. So now I'm going to jump into kind of some of the resources that we have available at Meraki, at Cisco, and just some of the offers that we've created to kind of help our customers through this time. So first, I just want to remind everyone that you can find your Meraki rep by going to merakipartners.com. It's the front page. You'll use your partner email address to log in or register if you haven't registered prior. Then you'll use your end customer's zip code to search and look for your Meraki rep there, and it'll have their kind of email and in some cases their phone number It's probably the easiest search tool I've found to kind of find who you need to be going directly to, and ScanSource is also very well equipped to kind of help you through that, navigate that process as well. And also on the Meraki Partner Portal, we have a lead generation tool. So we're constantly offering free webinars to our partners and to our end customers, and in some cases we're giving away free gear by attending specific webinars. But you can actually send your end customer to a webinar utilizing your unique referral code, and you'll be able to track if they've attended that webinar and what they registered for. So then you're able to follow up. Hey, I saw that you attended that healthcare webinar. Would love to jump on a call and chat with you about, any orders that you may need in order to kind of help facilitate. And then next, under that Meraki Partner Portal, we have a bunch of healthcare resources and even some objection handling guides there that can help kind of walk you through what that conversation looks like with a healthcare provider. And there's also some specific product related collateral as well. And we're actually going through kind of a transition with our partner portal. So you'll start to see kind of a new and great look over the next couple of months. That should make it even more intuitive than it already is. And if you're not familiar with Meraki's kind of free trial program, we love to give away free things. I say that we're kind of like Oprah in that way. Last year, we gave away about 100,000 pieces of free gear through our webinar program. And then because we believe so much in getting the Meraki dashboard and the Meraki product in front of our customers, we have a pretty seamless trial program. We offer free trials up to 14 days. Those can be extended when you work with your Meraki rep, but I've never seen us block a trial. I mean, I've seen trials that are 60K worth of gear. There's really no limit to kind of what we can have your customers try out. And then what's great about the trial program is that over 70% of free trials end up in closed business, which is why we believe so strongly on this model. And some of the other offers that are related to healthcare, you're going to see on the far left. So we're offering an extension for our healthcare customers, a 90-day free trial and next day delivery of Meraki gear for up to 20 pieces of gear. So instead of that 14 days, we're guaranteeing a 90-day free trial to really help get your customers the gear that they need in order to reduce any type of downtime. We're also giving away free licenses for temporary field hospitals and pop-up clinics. So those are 1-year licenses with any hardware purchase up to 10K. I urge you to reach out to your Meraki rep and ScanSource to kind of help you facilitate that and help you have that conversation with your customers. And then Cisco actually offered a business resiliency program. So this defers 95% of the contract cost until 2021, which is a fantastic offer there. So if you haven't spoken to a Cisco Cap rep, you can reach out to them around that type of offer. And then not technically related to healthcare, but still you're still able to leverage this promotion. It's the Meraki Remote Workforce Promotion. So this provides simplified pricing across all MI and MX products. So that's Meraki Insight, that's that application monitoring, as well as MX products, so our security products, SD-WAN, firewall product. And this provides an additional 8 points of discounts, and when it's stacked with OIP, it provides an extra 13% of discount. And this is done by creating a deal inside of CCW, selecting the remote workforce dropdown on the incentive. And it does say orders must book by July 25th, but I'm giving you some inside information that we're actually extending this beyond this fiscal year into, I believe it's Q2 of next fiscal year. So we are extending it, and you should receive some information coming out in the next couple of weeks. Probably shouldn't have shared it too early, but you get a first-hand look here with ScanSource. And then finally, our first year on us promotion that we launched back in September. So this provides an additional year of licensing on us when your customers purchase a 3, 5, 7, or 10-year license from Meraki, and that would be for new products, not renewals. But I encourage you to take advantage of this because this will be ending at the end of the fiscal year, which is July 25th. Just to summarize all those different offers, because I know I just said a lot of stuff and like a lot of great offers for you to take advantage of, but the first one being the first year a free licensing for field hospitals and pop-up clinics, and then a 90-day free trial for all healthcare customers, an MX and MI simplified pricing. That's that remote workforce promotion, but can be leveraged across all verticals. And then the first year on us promotion that'll end at the end of this fiscal year for all customers. Now, as I kind of close this out, I want to go over some kind of next steps. Like, of course, engage your prospects, really give them a call and leverage that unique referral code to invite them to some of the Meraki webinars. Leverage that collateral and information that's on the Meraki partner portal. Use that to access who your Meraki rep is to really discuss some of those healthcare opportunities and help you grow that. Contact your Cisco Cap rep if you want to talk about the business resiliency program and Meraki Easy Pay. And of course, involve ScanSource. They are your partner here. There are trainings specifically around Meraki, both on the sales side and more on the technical training side, and really get engaged with them to kind of help you within this vertical. But that is all I had. So I'm going to give you a little bit of time back for the rest of the day.